Joining me now with more is Director of the School of Public Health at Ben Gurion University, Professor Nadav Davidovitch. Professor, thank you so much for being with us. Now, first of all, at the United Nations, Bennett recently made it seem as though Israel is making incredible headway against the coronavirus. But many experts are saying that there's not really any such thing as winning in this pandemic, even in Israel, where some 1,200 Israelis have just died in the last 2 months alone. So how bad of shape are we actually in? Can you paint us a picture?
So indeed, there are no, winnings or eliminating or eradicating COVID. The way of depicting it, I think it's if you're learning to live with COVID, of course, not in a passive way, but in preparing a multi-layer approach. So we have in Israel a very strange even situation where on one hand we have very high vaccination rates, but we had also, because of waning immunity and also lifting many of the different restrictions during May, June, July, and a bit of a slow approach. Now we are finally getting into a much better situation. We see the reduction in the R coefficient, also in the percentage of positive tests, but we still have an overwhelmed healthcare system. It's very hard also to do contact tracing and breaking chains of transmission when you have thousands of cases. Overall, I'm very happy that we didn't get into a lockdown, but I think that there were some measures that could be started earlier. It was important to open schools, and there is no one way of winning COVID. Vaccination are crucial, but are not enough. And this is something we need to remember when the numbers are going down, not to forget it and not repeat the same mistakes we did after the previous waves.
All right, now it's fairly accepted that that the future, as you said, is one where we learn to live with the coronavirus. But are we ready for that future just yet? Bennett is saying that he sees the big picture. Health professionals apparently don't. Is Israel doing enough to slow the spread?
So I'm part of the expert committee. We sent, as we're always doing in a transparent way, the summary of our discussions. And we are still thinking that although we understand the broader picture, by the way, public health is not just about COVID cases. It's also about including broader perspectives about opening schools and its importance for cognitive and mental health, the importance of the economy and all of that. And we definitely thinking that right now, because of the current situation with severe cases, especially those who are ventilated or on ECMO, that we need to be cautious and not to declare any winnings soon. And thinking about some more restrictions, mainly about public gathering. Again, it's not about lockdown or things like that. And finally, it seems to me that the difference between Bennett and what we are saying is not so large. I also totally agree with the approach that we need to be very precise in our way of dealing with those who are not vaccinated, not just saying, okay, there is a mass of not vaccinated and targeting specific groups such as the Arab community. We know that people from low socioeconomic status are less vaccinated. So all of this is creating a very complex picture ahead of us that must be also communicated to the public, because there is pandemic fatigue. We need to invest in the public healthcare system, not just for COVID, but also for the future.
All right, Professor Nadav Davidovitch, thank you so much for joining us.
Thank you.